Now to a remarkable story, a new lease on life for a 26-year-old woman after her third double lung transplant. This is a procedure that's so rare, only 15 of them have been done in the U.S. By the way, 13 of them right back in our backyard. Health reporter Grace Haba sat down with her as she's on the road to recovery 1 month post-op.
Going through her daily lung function tests.
Just come lay down for a little bit.
With the support of her dog Millie, inside what she says is a lucky Durham Airbnb.
I met one girl who had a third transplant here at Duke. She was the third patient, I believe. And I found out that she would stayed in this exact place. So
Taylor Stephenson recalled waking up after a double lung transplant.
Third time's a charm.
That's right.
For the third time.
What was that first breath like?
Scary.
The Oklahoma native, born with cystic fibrosis, received her first transplant in 2015.
I went into rejection in 2019.
In 2020, she had her second transplant.
I did several medication regimens that they use to stop rejection.
But they didn't work. And by her 26th birthday this past October, she was in rejection again.
They were like, there's no other way to say this, but you need another transplant.
A team of doctors at Duke agreed to take her case. Her surgery last month made her the 13th patient to have the procedure through the hospital system.
For Taylor, she was checking all the boxes of what we thought a successful redo or third-time transplant, we call a 3-do, she could do well with.
Dr. John Reynolds is one of Taylor's doctors. He says for a long time, someone like Taylor wouldn't have been expected to live into their 30s. But in the case of redo transplants, new lungs have the potential to extend life expectancy by decades.
What we would want folks to be aware of is that this option is out there, and to have someone review their records and see if they're a candidate.
Moving forward, physical therapy will be critical to helping Taylor's body accept the new set of lungs. As she looks toward the months ahead, Taylor says this time feels different.
I've been telling myself the whole time, like, third time's a charm.
Grace Haba, WRAL News.
Wow. Taylor says her first piece of good news, by the way, came on Valentine's Day when she learned her first round of tests since leaving the hospital came back clear of rejection.